Hi, my name is Riley Rosebush.
And I'm Galen Gibson. We are both passionate about breastfeeding.
We wanted to make a video for mums who have babies with low tone to hopefully give them some tools to help them and their babies have a more successful breastfeeding relationship.
First, we'll discuss some of the common issues around low tone and how it can affect breastfeeding. Then, we'll demonstrate some massage techniques that can help increase babies' muscle strength and help them develop better muscle control. Lastly, we'll show you some slides of a mum and baby demonstrating dancer's hand, a technique that helps babies with low tone have better latch. So first off, we want to congratulate you for bringing a baby into the world. It is a beautiful gift. Likely, you know by now that breastfeeding is a little trickier for you and your baby, but the fact that you're persisting is amazing.
When we look at the studies and research, we know that breast milk makes the perfect food for baby every time they feed. It coats and continues the development of baby's intestines, protecting them against undesirable proteins. It's the food baby needs for optimal brain development. It creates antibodies against environmental viruses and bacteria, strengthening baby's immune system. Breastfeeding helps develop facial muscles. Breastfeeding can help develop your baby's oral cavity for later feeding, speech, and dental growth.
When a baby is born with low muscle tone, it is almost always throughout their entire body. Their bodies are usually floppier, including the muscles of the face, mouth, swallowing muscles, and digestive tract, and they are more flexible at their joints. Muscle tone isn't quite the same thing as muscle strength. We could help make muscles with low tone stronger and more skilled, but we can't change their overall tone.
Low muscle tone can affect breastfeeding and feeding development in several ways. Babies might have lower sucking pressure, lower sucking frequency, and shorter duration of sucking behavior. This means initially that they may be less efficient in their breastfeeding and may get tired more quickly.
Babies with low tone may have difficulty with achieving certain movements and differences in sensory processing. So they might have more difficulty closing their lips and tongue around the breast or trouble moving toward the breast. As well, they may be underreactive to sensations, not realizing they are being touched, but also could be overreactive or show a confusing mixed response. Low muscle tone can also change the speed and timing of how muscles work together. This becomes really important when you consider swallowing. Swallowing requires quick timing and coordination of about 25 pairs of muscles. If the baby has an uncoordinated swallow, some of the milk can go down the wrong tube and into the baby's lungs. This is a situation you and the baby will both want to avoid.
While we can't change the muscle tone a baby is born with, we can help the baby use their muscles and sensory skills to the best of their ability. With the right kind of practice, they can develop both strength and skill in their feeding muscles. You might also be interested to know that the structures we use for eating are many of the same we use for talking and breathing. So breastfeeding well can provide a solid foundation for later speech and breathing. Also, breastfeeding contributes to better outcomes in facial development because it helps the face, head, and jaw grow appropriately.
Many of the problems babies face early on can improve as baby matures. If your baby isn't breastfeeding now, but your goal is to try to breastfeed eventually, find support to maintain your breast milk supply and keep your baby well fed and healthy. Studies show that some babies who have difficulty at first have matured their feeding skills at 4 months, and then see another boost in development at around 8 months. Your baby might gradually work towards exclusive breastfeeding by starting off with a combination of breastfeeding and alternative feeding methods.
We'd like to show you some exercises that can help babies with low tone develop the muscles they need for breastfeeding. Every baby's body and needs are different, so please contact your healthcare team about what's best for your baby. You might contact a lactation consultant, midwife, registered massage therapist, speech-language pathologist, occupational therapist, physiotherapist, or myofunctional therapist who has experience and training to work with infants with low tone.
Infant massage has many studied benefits. It helps create a lovely bond between parents and baby, strengthens communication, improves digestion, and sleep. Infant massage is a dance between you and your baby. It takes a little practice, it takes a little time, but in the end, you and your baby will be better partners. You're going to watch a mom learning some new infant massage techniques. She's going to start by getting her baby's attention, by getting face-to-face and interacting with her through talking. Breastfeeding is a whole body activity, and activating their bigger muscles will stimulate their smaller ones, like their mouths, cheek, and throat muscles.
All right, So you have her lying down right in front of you, and you're just going to get her attention by kind of looking into her face and talking to her. Hi, sweetie pie. There she is. Now she sees you. Oh. And you're getting her attention, getting her all ready. So now we're going to start massaging her by just taking her hands. Yeah. And you can put them on her feet and legs and giving her gentle squeezes all the way up. Sure. There. Hi, babes. Nice and gentle. Hi, babes. And you can go up her belly and then to her arms. And there's Mommy. Do you like that, sweetie?
One way to alert your baby is to wipe around her face using a cool washcloth in quick, gentle motions. Try moving from the outside towards the middle. Forehead, under chin, ears to cheek to mouth. And finally, we want your baby to focus on using their mouths, so end the washcloth wake-up by wiping around your baby's lips. This is a great technique to do before every daytime feed. Here's a little anatomy to show why touch is important. The slides are, of course, of adult structures, but your baby's has the same ones in miniature. All the yellow lines are nerves, and for the most part they communicate with each other. They are the nerves of eating, swallowing, and speech. By lightly stimulating the skin that is on top, you are also stimulating the nerves and getting them ready to work. First things first, you want to get in a comfortable position with your baby. Speech therapist Diane Barr suggests sitting on the floor with your feet together and baby's head rests on your feet. This way, baby is supported and you can make eye contact with her while you massage. Another choice could be having your baby lie in the crook of your leg with her head supported on your knee.
Before you start massaging baby, make sure your hands are clean and nails are short. Aim to repeat the sequence twice a day. If your baby starts to look uncomfortable as you progress with the sequence, back up a step and try to gradually work towards her sensitive areas. The face and mouth are often more vulnerable, so it might take a little longer for your baby to enjoy touch there. Watch your baby to see how they react. Experiment with different types of touch and pressure to find what your baby likes best on certain parts of their body. We want the massage you do with your baby to be enjoyable for both of you. Eating should be a pleasant experience. Don't start massaging if your baby is already too hungry, frustrated, or crying. They won't be open to new learning. Also, if your baby is already battling an infection or fever or has a skin condition, leave the massage for another time. You're going to watch 2 clips of a baby telling us how she feels. In the first clip, Mom elicits a sensitive gag response, so she stops right away.
Oh no, she gagged. Oh, sorry, too far in. Oh, we start again. We start at the beginning.
Kind of move
Here, baby looks much more comfortable.
Only up to not any farther than your first knuckle. Okay. Infant massage is a great way to develop your very early communication skills with your baby. Watch their face and eyes, hands and toes. A grimacing face and arched back is baby's way of telling you stop.
Here we're starting this baby's massage with gentle circular motions around her head.
So it's a nice way to hold your baby to support them if they have low tone, right? To have your foot hooked over. Oh no. Little tiny babies.
Yeah, and they can feel the kind of boundaries of where their legs are.
Yeah.
Like orientation.
Yeah. Little tiny babies.
Next we use our little circles on the jaw joint and jaw area.
Hello, there's your cheekbones. Look at that. Oh, look how strong they are. Yeah, they are. Look at your chinny chin chin. We can barely find it.
Totally. I have to wash her folds every night and then dry them with a hairdryer. Otherwise she stinks.
She's really smelly.
Finally, she uses her fingers around her lips and gently pulls them together towards a closed position, including the upper and lower lip.
Definitely.
Rotten.
Yeah.
Some babies with low tone are at risk of developing a high arched palate, especially if they often have their mouth open or tongue out when resting. Your hard palate is the bony part of the roof of your mouth. It also forms the bottom of your nose cavity. A high arched palate can interfere with nose breathing, clear speech, and some aspects of eating. Your baby's palate is like the bones of their skull. They aren't quite finished fusing together yet, so there's still a soft spot in the middle where the plates are coming together. We want to avoid pushing up on this soft spot in the middle, and instead use the broad part of your index pad to firmly but gently sweep out towards the side where the teeth will come in. Stroke the baby's palate from the middle to one side 5 times, then go towards the other side.
Sometimes babies who have low tone are at risk of getting the top of their mouth, their palate, to kind of form up in a high arch.
Okay.
Which can cause trouble because the top of your mouth is actually the bottom of your nose. And you want that area to be wide open so you can breathe really good through your nose. Oh, I know. So at this age, until she's a bit bigger, your palate's actually still fusing, coming together.
Yeah.
So we can take our finger,
Yeah.
the front part of your finger here,
Yeah.
and you can gently roll it out on the top of her mouth.
So right from in the middle?
Right from in the middle, and then you're going to roll right to her gum ridge where her teeth are going to come
And then
out.
do I need to be gentle in that top portion because...
But yeah, because that part's so soft, just like the soft part in her skull.
Okay.
So it's going to be really gentle and firm pressure all the way through.
All the way through, so
All the way
no
around.
pressure when I'm just initially in
Exactly.
there, and then as you come through,
Yeah,
add
then,
pressure then?
Yeah, pressure then, and keep it very
Okay.
consistent. Watch this mum and baby trying the palatal massage for the first time. So if she'll let you, what you want to do is take your little finger and find just the middle of her palate, and don't press up, but as you're going to roll your finger out to the side towards where her teeth are, just applying kind of consistent pressure.
Both sides?
Yeah, exactly. You go to one side like 5 times,
Okay.
and then switch sides. Are you finding her teeth on the side, or the gum ridge?
Yeah.
Awesome. Yeah. So that like the hard palate's just like the bones in her skull, at the bottom of your skull. So the same kind of soft spots.
Okay.
Now we're going to try an exercise called tongue bowling.
You can see in this picture, the baby's tongue is a cupped or bowled shape. This shape helps the baby to maintain latch on the breast and also helps direct milk flow. The exercise is to use the tip of your finger to create a groove or cup in the shape of the tongue.
Flip your finger the other way, and then if this is her tongue, you're going to start tickling the front and kind of move it just a little bit back, like only up to, not any farther than your first knuckle, but you want to see if you can feel her tongue cupping around your finger. Do you feel that?
Just smiling.
Yeah?
Big smile, yeah.
Baby needs a strong and mobile tongue to help with latch and later eating activities like pushing the food around in his mouth. Lateralization helps the baby's tongue move to the sides of the mouth to practice these movements. Watch Mum use her finger to stroke the sides of baby's tongue. So lateralization of the tongue, here we go. Hello, hello, hello. Look how beautiful she comes to the right side. Let's see what happens to the left. La 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 la. Oh, look at that. Look at her tongue chasing my finger. That is so perfect. Look at you. You're like the smartest girl ever. Babies have a reflex called a phasic bite, where they start to munch up and down when they are touched on their gums. We are going to try to get this reflex going so babies get lots of practice opening and closing their mouth against pressure. If babies can't maintain a seal on the breast, they sometimes clamp down instead of holding it with their lips and tongue.
Strengthening the muscles in their jaw will give them better control of these movements and ultimately less painful feedings for mum. You want to take your pinky finger and put it on the baby's bottom gum line near the back where the molars will eventually come in. Wiggle your finger. You'll feel baby start to bite down. This is good.
If you don't feel a baby bite down, wiggle just a little bit more. Your baby might need more sensation.
Lots of times babies with low tone have a little bit of weakness, so they have a harder time opening and closing their mouth and keeping it stable.
Okay.
So if you're breastfeeding, sometimes they might try to get stability by clamping down, and that can hurt mom. And when you're ready, we're just going to take our finger and use the soft part on the side right on her gum line. Ooh, that's right there. And do you feel her biting down?
Oh, yeah.
Yeah, so that's a reflex that babies have. It's called the Phasic Bite. So we want her to just use that. We're using that reflex that she has to help her get that movement going, like exercise.
She likes that one.
Yeah. The dancer's hand position can be used to help support baby's chin and cheeks for breastfeeding. In this photo, you can see Mum's breast resting on the pinky, ring finger, and edge of her hand. She's going to use the web space between her thumb and first finger to support her baby's chin like a saddle. When the baby is on the breast, Mum's thumb and first finger will be supporting the cheeks and pulling slightly forward to help the baby flange her lips and maintain a seal on the breast. Here you can see baby approaching the breast with Mum's hand already in position. In this picture, baby is on the breast and mom is helping her create and maintain a nice lip seal.
We've covered a lot of information, and we wanted to give you a quick review of the frequency of each technique that you'll do at home. The whole body squeeze or rub you'll want to do twice a day. Cool face cloth wash helps alert the face muscles, good to do before every daytime feed. The exercises for in the mouth you'll want to repeat several times a day. Tongue bowling, press the top of the tongue to make a groove in the middle. Press, press, press 5 times and do 3 sets. Tongue lateralization. Have your finger in between the baby's cheek and tongue, about midway. Sweep the sides of the tongue so it chases your finger. Sweep, sweep, sweep 5 times, each side per set. Do 3 sets. Phasic bite. Let the baby bite on your little finger near the back. Bite, bite, bite 5 times on each side for 3 sets. And palate massage. Gentle pressure from the middle to the sides. Sweep, sweep, sweep 5 times each side for 3 sets. Above all, have fun while you do these exercises. Joy makes the learning easier for everybody, for you and for baby, and you won't be doing it forever. We hope you enjoyed our video. We want to thank all the mums and babies who helped us by volunteering their time and energy. They are all passionate about helping other mums and babies become better breastfeeders. Thank you to our editors for their time and effort. Brendan Yount initially edited our video, and Mary Ungeleiter put in the finishing touches. An especially big thanks is needed for Christy Robin, who filmed and photographed with a new baby on her breast.